Hi, it's Amy from California, your on the go safer beauty coach.
And I'm Andy from Minnesota, the nicest ingredient safety nerd you will ever meet.
I love it. Join us today for this exclusive interview with Suzanne Price as we spotlight her work as interim CEO with Breast Cancer Prevention Partners and their vital work in the women's health industry.
This is Coast to the Heart.
I'm so excited about this episode. Hi, everyone. Suzanne, welcome. Why don't we start out with you just sharing a little bit about yourself, how and why you got involved with Breast Cancer Prevention Partners, and then maybe tell our listeners a little bit about BCPP's mission.
Yeah, absolutely. Thank you so much. And thank you for the intro. And I just want to say that actually, as of last week, I'm no longer interim CEO. I am just regular, full-time, permanent CEO.
Just got the chills.
Goosebumps all over my arms.
I just got goosebumps. Congratulations.
Oh, thank you. Thank you.
That's incredible.
That was always my intention. And I'm so excited to move forward with the organization. As with all management changes, it took a while to just make that official, but we're excited to just move forward and see where we can go from here. So yeah, I'll tell you a little bit about BCPP and how I got here. I'm starting with the org itself. BCPP was founded 32 years ago in San Francisco by a woman who was relatively young and healthy and had no family history of breast cancer and was diagnosed and sought to understand what could be the factors in the environment that could be leading to this disease because there was no genetic connection. And actually, it turns out that in 90% of cases of breast cancer, there is no direct genetic connection. I think a lot of people feel that this is a disease of if you have the BRCA gene or you have a family history, then you have to be concerned, and otherwise you don't need to worry. But the majority of cases are not linked in that way. And that means that the growing cases of breast cancer that we're seeing, especially among younger women, really have to be linked to something environmental or lifestyle related that is changing around us and explaining why these cases are increasing so much. So Andrea Martin founded the organization, went down this path, became really one of the founders of the environmental health movement in our country. Unfortunately passed away 10 years later. And then Jeannie Rizzo took over the organization and ran it for 17 years and became really known for our work in environmental health in looking at the environmental causes of breast cancer and doing something to prevent it. So we've passed now 20 state and federal laws over the past 20 years. And I'll tell you about our 20th that just got passed last week. But we've worked on legislation, on market-based campaigns, getting companies to remove harmful ingredients, and then, of course, on educating the public and teaching people how to both make safer choices for themselves, but also to be advocates for a safer environment for all. So those are the areas in which we work. And Jeannie retired right before COVID. We had someone take over the organization for a number of years up until last summer. She stepped away, and now here I am. I've been, even though I'm new in this role, I've been involved in the organization for a very long time. So my story is kind of a roundabout way to get here. And I actually met you, Amy, in my previous life, but I 15 years ago, started to become aware of the harmful chemicals in our everyday products. And that was through a finance job that I had where I was looking at the growing movement of clean cosmetics and other consumer companies that were focusing on organic and healthy living. And I started to realize that this movement was actually based on some real science that showed that there was especially hormone disrupting chemicals in a lot of our products, and that the list of chemicals that was banned in Europe and sold here was so shocking. And I just felt a real injustice about it and felt like I had to do something about it. So at the time, having more of a business background, my answer was to start a business that would help people find safer products. 15 years ago, I opened a small chain of baby stores called Sprout San Francisco. We grew to 6 stores around the country before COVID, and we sought to both provide healthier products for families and also educate our customers and help them become advocates as well. After doing that through COVID, we shrunk the stores back to the Bay Area. We still have 3 Sprout San Francisco stores in the Bay Area and our website, which provides only the healthiest products for new families. And that still exists, but it's been running a long time. And I started to think that maybe this could run without my day-to-day involvement. And in the meantime, through that work and through getting involved with a number of nonprofits that did this kind of advocacy work, I joined the board of Breast Cancer Prevention Partners 7 years ago and was just so enamored with the actual change they were affecting, not just researching and educating people about these chemicals, but creating real change in our environment through the work they were doing, that I just dove deeper and deeper in, was spending a lot of my free time helping them as much as I could. And when there was a management change and I was trying to figure out what was next for me, it seemed meant to be. So stepped in as interim in January. And as I mentioned, now I've officially been named CEO.
That is really quite the journey. And I will say that, the part that I took a little note here about Sprout San Francisco, I will say, talking about how we all got here, I work full time in the commercial real estate industry. It is no easy feat, Suzanne, to step into that and create a concept that is not only makes the consumer aware, that is engaging, but that is helpful and that keeps them coming back. So I applaud you for that. In your community, and everyone who shops at Sprout is very, very lucky to have such an incredible resource. That's outstanding. One of the things that, again, we're all here because it was very important to us to figure out and understand the difference in and the lack of safety regulation in the United States versus Europe and even Canada. And that was something that we've all talked about before. It has struck a chord within each of us in a very different and unique way. Aimee and I, although we're in Minnesota and California, and we were with the same brand of advocacy, beauty products that we were working with, we didn't meet until we were on Capitol Hill. And that's something that we've talked about, over and over again. We didn't meet until we were on Capitol Hill. And I think as we think about how impactful that day was, it is amazing to me to look back to the work that happened this summer. So this past summer, breast cancer prevention partners, along with clean beauty badasses, but CEOs went back to Capitol Hill and began really lobbying for that safer beauty package once again. Not saying that we ever stop, but we're headed into a season of, elections and all those kind of things. It was really important and integral that we got out there this summer. So, to recap for everyone, the Safer Beauty Bill package, the 5 bills, they're set out to, 1, ban the worst toxic ingredients first. Okay, so we're talking formaldehyde. We're talking terrible ingredients that should have no place in personal care products. Most importantly, we want to defend the health of women in color and salon workers. That's another passion that is extremely personal to me. Having worked in the professional salon industry for many, many years. We talk about artificial fragrance and sneaky fragrance ingredients. We need those ingredients to be revealed and publicly disclosed. And supply chain transparency is something that we always talk about. You could have the cleanest, squeakiest clean product inside of that formula. But if the supply chain is faulty, if even the packaging has these harmful ingredients that are leaching into the product, we're just taking 3 steps backwards. So, and finally, banning PFAS once and for all. We can't shout from the rooftops enough about that. So it sounded like, and again, we talked to Janet Noodleman about this as well. It sounded like your day was filled with meetings. We all watched that social media, but I would love to hear it from your perspective. Can you just walk us through that experience and share some of the highlights of that day?
Yeah, absolutely. And like you said, a group of us, including the 2 of you, have been lobbying on these bills for a while. And sometimes it's frustrating how slow things move in the federal government. However, I think we all found it extremely valuable on a number of levels. 1, every time you meet with a new staffer or congressperson or senator directly, you're able to share something that they didn't know before, that they're going to take with them into the future. So we met with Kirsten Gillibrand's chief of staff, and he didn't know that fragrances were not currently needed to be disclosed on ingredient labels. And we sometimes take things for granted, those of us who have been working on these issues so long, that that's just a given. So we did hear a lot of interest from a lot of different offices about currently working on food packaging and food related issues. So people do understand the need to protect people from what's in their food and what's in their food packaging. But a number of the people we spoke to really hadn't thought about that in terms of beauty and personal care products, which is really surprising. And we really made the point that everything that you're putting on your skin is getting inside your body. Everything that you're smelling is getting inside your body. And I think that people were really intrigued by that. And it did make them think about this as a higher priority issue. So that was really effective, just to make sure people were looking at it with that lens. And then we did go to the White House this time, which was really exciting as well. And we had a number of meetings in different offices in the White House. The First Lady's Women's Health Initiative, the President's Cancer Moonshot Program, and again, mostly we're teaching these staffers about issues that they hadn't really thought about and really pushing them to think of prevention when it comes to cancer and to think of the equity issues in terms of women's health that come from these products. And we all know that the absolute worst chemicals are in ingredients marketed to women of color, and then thinking about salon workers and other areas where there are equity issues. And then we pushed people to think about advice in terms of maternal health. So a big focus of this administration is better maternal health and guidelines for pregnant women, and really talking about exposures during pregnancy and how important that is, and that it hasn't been something that's focused on. And I feel like we made tremendous headway with getting these new ideas into the minds of the people we were speaking with. And whatever happens with the administration next year, presumably a number of people we met with will still be influential in government in some way or another. And so I felt it was extremely effective. Another thing that was really wonderful about bringing the CEOs of some of these top clean beauty and personal care companies with us was to show the lawmakers that we met with that you can do this profitably, because a lot of times they're only hearing from the Personal Care Council, which is the big lobbying group for the personal care industry, the mainstream personal care industry, who's just always making the argument that you're going to ruin our companies if you make these laws. And each one of these CEOs with us stood up and told their story and explained, I've been doing this for many years. I've been disclosing my fragrances. I've been checking my supply chain to the extent I can, pushing on that supply chain issue, that how much can I even do if my suppliers aren't mandated to disclose to me, and really sharing that they are trying to do better and they have been doing better and that they have successful businesses and this works. So that was extremely effective. And also to give these lawmakers and their staffers a place to go to ask these questions, because when they're hearing the Personal Care Council give one side of the story, they don't have the resource. There's no trade association for clean beauty companies yet, at least, to know that they can use us or these companies directly as a place to go to hear the other side. I think was really helpful.
So exciting. We talk a lot about how our voices matter, and we'll talk a little bit about this later as well. But when we were there in 2020, when were we there? 2022, right? To your point, even in California, so many of the offices we talked to were like, wow, we had no idea. We had no idea this was even an issue. And we love the fact that it only takes 21 reach outs to an office about a topic for that, that topic to have to be researched by the legislative. So you're right. Just, the more we talk about this, the more people hear about it. It's mind boggling that there are offices at the federal level that still don't know about this, but that's all we can do is keep talking about it. I'm curious because we focus so much on talking to Congress and the legislators. You mentioned you were in the White House and talking to the first ladies, staffers, and White House staffers. How influential can they be? Because they're not Congress people necessarily, but they're part of the administration. How would they work together to keep pushing this safer beauty mission forward?
Yeah, it was really encouraging to me, actually, because it seems like we might even have more of a chance to affect change in the near term by working with offices in the White House, because they can do certain things like put out guidelines. They publish guidelines on what should the standards of maternal health be, what should doctors be telling their patients, and they can make suggestions and put out guidelines like that without going through lawmakers in Congress to create a law. And that has a huge effect, and in terms of publicity, in terms of getting the word out, in terms of becoming the standard of care. So I think that will be a new avenue for us to really work with the White House, and depending on what happens next, and see what they can do that can move the needle without having to go through the very long lawmaking process.
That's incredible. I mean, I love that. Another channel, like you said. Are you hopeful that another omnibus bill will be passed at the end of the current presidential term, like MOCRA, which many of our listeners have heard us talk about? The Modernization of Cosmetic Reforms Act was also part of an omnibus package at the end of 2022, which Andee and I felt so proud of because we had done some work that year, in Washington, D.C. Do you think something like that can happen again this year?
Unfortunately, I'm not super optimistic about that. I'm not the political expert. You had Janet Edelman on. She is just, 20 plus years in the ins and outs of those type of negotiations. But I personally witnessed a lot of feeling that, okay, we did MOCRA, check the box, that's taken care of. And so another reason these meetings were important were just to highlight the issues that still exist, what needs to be done next. So I think it would be very much optimistic to think something like that would happen in the near term, especially with the current state of our government and all the other issues at hand. But it's good that we're getting in front of people and letting them know that that didn't solve all the problems.
Yeah, that was just the tip of the iceberg.
Hey, it's Aimee and Andee. And when we say we want to hear from you, we really mean we want to hear from you as we are preparing for season 2 of Coast to the Heart. We want you to DM us at Coast to the Heart on Instagram. We want to know what's on your heart, in your heads, in your minds, and what you want to hear on this podcast.
And we so appreciate your support and your listening. If you are continuing to enjoy Coast to the Heart, please subscribe, rate, review, and share our podcast.
Okay, so Aimee, you talked about what we did in the past. Suzanne, you talked about what you did currently. We're all working together. We're all trying to move this mission forward. So it doesn't have to be around an election cycle. We certainly know that. This work never stops 365 days a year until there are safer products in the hands of everyone. And these issues are bipartisan. That's one thing that I know we all feel good about, that both sides of the aisle know what is right when it comes to human health. And we're going to keep pushing that mission forward. So now let's go back and let's focus, since we have the CEO, not interim CEO, the CEO of Breast Cancer Prevention Partners on this podcast with us. All right, Suzanne, tell us, what is BCPP planning for Breast Cancer Prevention Month, and how can our listeners support your efforts? We want to know how to get involved.
Thank you so much. Well, I do have to share one really exciting recent win, if that's okay.
Please do.
And it's not cosmetics related, but it is very exciting, and it is something we're going to be really trying to educate people about through this next month and ask people to take action on. So just last week, Newsom signed into law a bill that we had sponsored that is about getting phthalates out of IV tubing and bags. So for your listeners that don't know, although I'm sure many of them do, phthalates are endocrine disrupting chemicals that exist in fragrances, but also in soft plastic. So back in 2008, Breast Cancer Prevention Partners worked to get phthalates federally banned from plastic toys. They used to be in rubber duckies and any soft, squishy toys. They're used to make PVC plastic soft. And it was very clear that they don't stay on the plastic, that if a toddler were to suck on that toy, it would come right off into their mouth and go into their bloodstream. And it is a known enough endocrine disruptor, especially the specific phthalate, DEHP, that was often in these toys. It was known to be bad enough that the federal government agreed to ban it from plastic toys. Today, DEHP phthalates are in 70% of the IV tubing and medical bags in hospitals throughout the country. So that same squishy plastic that you used to have in plastic toys is being used in these medical devices, and not only being around hospitals, but being pumped directly into the veins of patients. You think about NICU babies, cancer patients, where this chemical is actually known to counteract the effects of chemotherapy. This is horrific, and anyone who learns about this is up in arms about it. And we've been trying to spread the word, and we did get a bill passed last week to ban it. As is typical in these type of laws, there was compromises made, and there will be a 5 to 10 year, depending on the exact product, time horizon before the companies that make these products have to comply. So our next step is to go out to hospital systems around the country and get them to sign a pledge to get out of DEHP. And not only DEHP, but the PVC itself, which itself is harmful because there are alternative plastics that are currently being used. So our pledge is for hospitals to get out of DEHP and PVC plastic in these products in the next 3 to 5 years. And we've already gotten a couple of huge hospital systems to sign on. So we're really excited about that progress. And then we'll be making it more of a public awareness campaign where we can ask patients and doctors and nurses to sign a petition along these lines as well. So that's going to be a big push of ours right now, just building on the momentum of this bill passing in California and then hoping that it ripples through the rest of the country.
Well, and one thing I want to go back to on that, when you were talking about, DEHP and PVC, you walk into Target, you walk wherever you're in the home goods section looking for a new shower curtain, and everything is, PVC free, PVC free. You don't want PVC in your shower, but it's okay to have it in a hospital system. And I think when Aimee and I first learned about it, I'm getting goosebumps again. The thing that when we first learned about this was that there are brands and manufacturers who are not using DEHP in their tubing and in their IV bags. but it's going to be a more expensive product. So we go for the less expensive product and mass produced products that have the harmful effects. Why do we do this when we have a choice? And I think that's the part, Suzanne, where it's like, we are all trying to spread this awareness. So when there is that petition or when there is that thing that we can do for you, let us know, because the more people we tell about this, the more people we share our previous episodes on this topic, they are absolutely stunned. So thank you so much for your work on that.
The good news is actually Kaiser Permanente, the biggest hospital system in California, switched out of DEHP and PVC bags and tubing over 10 years ago. And they said that they actually saved money. It doesn't have to be a more expensive product. Sometimes it's just about a company investing so much in their current manufacturing processes that the actual change will cost them a lot of money. But for the hospitals, it shouldn't be more expensive. And it's really about getting those few manufacturers that control the market to have to switch from something that they've invested a lot of their processes in.
Wow. Well, and the good news is, we've talked about before, what happens in California often does have a very positive ripple effect, or either with in other states or at the federal level.
Absolutely. And just because California is such a big marketplace, that often when a product itself changes for California, the manufacturer doesn't want to make a separate one for other states. So they end up changing even before the laws change elsewhere.
Fingers crossed that happens with this.
Yeah, thank you.
Yeah, well, we were, like Andee said, we were shocked when Janet is the one that first told us about this. We were like, oh my gosh, I literally jaws on the floor. That
makes sense. Well, Janet pushed it through, and just one example of her many years of amazing successes in legislative efforts. So lucky to have her.
Yeah, she's incredible. Anything else in plan for breast cancer prevention partners? And I need to go close this door because it's very loud. I'll be back while you answer that.
Okay. Of course, we're always trying to not only shame the companies that are doing something wrong, but really promote the companies that are doing things right. And so, as usual, during Breast Cancer Prevention Month, we will be highlighting some of our strong partners who are really providing safer products on the cosmetic side and also in other areas. And so throughout the month, you'll see promotions and us trying to raise up the profile of the companies who are really doing something better. There's that. For those of you who are listening who may be in the Bay Area, we have October 19th, our annual hike for prevention down in Pacifica this year. It's a beautiful hike. It's a really great community event. So anyone who can come, it would be really fun for you all to have a team and come join us. That's been going on for many, many years. Hiking is core to our organization, how we raise money and how we enjoy being outdoors and healthy together. And, we'll just have lots of education throughout the month about all the different areas we're working on and what's coming next. We've been working for a couple of years. I don't know if Janet spoke about this on here, but we've been working for a couple of years on our Safer Black Beauty project to really let people know about the very harmful chemicals that are in products marketed to Black women, and we have created a database of all the healthiest products out there in this market, and it's very searchable, usable. We want to help get that out there to the world so that people who need it can use it. So we'll be promoting that. One thing that I'm personally very passionate about is getting this message out to younger girls and their moms. There is a huge trend of tweens at Sephora and young girls wearing a lot of makeup and using a lot of facial products. And I think that for the most part, they and their parents just aren't really aware of some of the harm that can be associated with some of those products. So again, always trying to put a positive spin on it. We've been telling people, if you go to Sephora, look for the green leaf products or try to find a way to shop safer. But hopefully we'll do some more education around that.
Yeah, I've got two Sephora kids in my house. So they are precisely in that strike zone, 12 and 15. And we are that family. We walk around with the Clearia app inside of Sephora. We teach other people in the aisles how to use it. My girls know you can look at it in the store. You can try it on. You can take that selfie with that picture. It is not coming home if it is not clean at Sephora and passed by Clearia. So yeah, we live that life to the core, Suzanne.
I love that so much. Well, I have a 12-year-old daughter and a 14-year-old daughter as well. So right in your same ballpark. And they've just been taught since they were very young how much this matters. So they aren't fighting me on it. But it's funny to hear how sometimes they have to fight their friends or even their counselors about it because people don't think they know what they're talking about. I say counselors because we just had an episode come up at camp. Share, if you'll indulge me, one personal story. My 12-year-old is very into acting, and she went to acting sleepaway camp this summer. And when we showed up at the end to see the big final show, we saw her right before she went backstage, and she said, "You'll notice I'm the only one not wearing makeup. And that's because I asked to see the ingredients. And the counselor who was putting it on me said, what are you even looking for? You know, these are 20-year-old counselors, and they think my 12-year-old doesn't know what she's talking about." And my daughter looks at it and says, "Oh, this has talc. I can't use talc-based makeup because talc is laced with asbestos, and asbestos causes mesothelioma." This is what my 12-year-old said.
How proud were you, Mama?
Yes.
Because she watched the HBO show Not So Pretty that Jenna Noodleman was in, talking about talc-based makeup, and it really stuck with her. And the counselor said, "It's ridiculous. You know, we wouldn't have this if it was harmful for you." All those lines that they have no idea. And she's trying to stick up for herself, and they think she's a kid. She doesn't know what she's talking about. But in the end, she refused to use it, and they didn't have any alternative, and it was fine. They don't even need makeup at this age. It's so ridiculous in the first place. So I was very proud, but I do feel bad that it's such an uphill battle for these kids to have to explain that to even adults in their lives.
Well, and
So important, like, because they're the future, right? So I was going to ask if personal stories about you because I knew you had 2 young daughters too. So I love that. And it's the only way we're going to make any changes with that. I think not the only way, but the biggest impact is going to be that generation. So when they know this, that's huge. And then they can share.
I mean, just from a women's empowerment issue as well, it's really frustrating to see these young girls feeling like they need to use all this facial product and makeup in the first place, because not only can it be harmful, but just so not necessary. And I hope we can help create that trend as well.
You guys, some of the reels that you have done on BCPP's Instagram, for our followers who don't follow them, please do. They're really powerful, I think, because it does have the young girls in there. I don't know if your girls were in those videos, but yeah. But those are, that's really important and powerful stuff to see. Andee and I both do a lot of events with teens, and I just did one about a month ago. And the brands that they were listing off that they use, and the influencers that they follow, and the reasons why they do it just blew my mind. But they were open to what I had to share, and they loved the makeup that I brought. It was all clean makeup. It worked just as well. So we just need to keep spreading the word. That's for sure.
Well, Aimee, locally, definitely let me know when those type of things are happening. I'd love to bring my girls to that.
I will. Oh my gosh, that would be amazing. And then also, speaking about your hike, I'm unfortunately going to be out of town this year for it, so I won't be able to be there. But there is always a group from my former beauty team that does participate. So I'll share that information in the show notes, you guys, if any listeners want to get involved in that hike in a couple weeks.
Thank you.
Now I'm having FOMO, but keep talking about it. Keep talking about it.
I know. No, it's great. No, I do, but I do want to get together in person. The last time I saw you, I think, was in your Sprout store, which was a long time ago.
Yeah,
so.
and I still am there a lot. So next time you're in the area, let me know, because I live right by that store. But sorry, Andee, didn't want to leave you out. And one thing we are really trying to do at BCPP is travel around and meet with people in different areas, because we do so much work outside of California as well, but we are most well known in the Bay Area. So really trying to help spread that message and have events in different places. And I have some close friends in Minnesota, so maybe I'll get out there and we can do something together as well.
We can go around Mall of America, Suzanne, and we can, we'll go through all the 2 Sephoras that are there. We'll go through all of the stores. It'll be great.
Wow.
It'll be great.
Wow. Well, this has been so amazing. We love having you, Suzanne. Thank you so much for your time. One last question. We talk a lot about coaching our listeners to use their voice, the impact they can make. It just takes a few phone calls to make change happen. What ideas or thoughts do you have for our listeners on how to most effectively ensure their voices are heard on whatever topic that they're most passionate about?
Yeah, I guess I'd say there are 2 things. On our site, we have a take action section. It always lists all the recent initiatives, both state and federally, that we're working on. People can always sign on and have it automatically sent to their congressperson and just help lend their voice in that way. And then I would say people should educate themselves about these issues and what they need to look out for in their homes and their personal care products, and then to share that message with friends, because that's really the way it gets out there.
Absolutely. Great advice. I'm still thinking about your daughter and the refusing to wear the makeup and the education she did. That's amazing. I'm so happy you shared that story.
Well, hopefully we can share that type of thinking more broadly with your help.
Yeah, well, absolutely. We'll do all we can. That's for sure. Well, thank you so much. It was so incredible to hear all about the things you've done. I think Andee and I could both keep talking to you for hours because we're so passionate about these topics, and we're so thrilled that you are now the official CEO and that you are the voice for this Breast Cancer Prevention Partners campaign, 20 laws in 20 years. That's incredible. And we're just, really excited and hopefully have empowered a few more people to realize their voice really can make a difference.
Absolutely.
Thank you so much for having me.
Well, and I was going to say breast cancer prevention is something that we can all get behind. We can all rally behind it. And the campaign for safe cosmetics, again, is something that we will always, always talk about. Everyone can stand behind that. I don't think there's anyone on earth who thinks that it's a good idea to have asbestos-laced talc in their personal care products. So your daughter is one smart cookie. I'll tell you that much. I hope today's episode gave our listeners the tools and the motivation that they need to take action. So whether it's advocating for safer products or supporting the incredible work that Breast Cancer Prevention Partners is doing, every little bit helps.
Absolutely. And speaking of supporting, we're so grateful to all of our amazing listeners. This is our 33rd or 34th episode of the season. And we're going to take a little pause and come back with season 2 very soon. And please share what content you would like to hear from us, what things you would like to talk about, guests you would like us to bring on. We're just having so much fun with this and really appreciate when we hear from you guys, just even if it was one little tidbit or one little action that you've taken because of something you've heard from us. That's what this is all about.
Absolutely. We've covered so much ground on these first 34 episodes. We can't wait to have you come back for season 2 of Coast to the Heart. Right now is the perfect time, by the way, to go back and listen to all of the episodes that we previously recorded. So until next time, everyone, stay healthy, stay clean, and take good care of yourselves.